Hey, How, long time no see? Come over here. Are you here to eat? Yeah, are you meeting friends? Yeah, he's treating me to dinner today. That's nice. Why didn't you mention it? Remember when we went to play ball? He suddenly collapsed. And he stopped breathing. I was shocked and thought, I learned CPR before. So I started doing chest compressions. Then he was sent to the hospital. Not long after, he was discharged. And he's treating me for dinner today. Really? No way, right? No way, no way. How is that possible? By the way, what you mentioned earlier, Jajadian, what is that? You don't know? It's out of the loop? Come on, just tell me. Fine, I'll say it myself. Good morning, everyone. Today's lesson is CPR and AED. First, let's talk about why we choose CPR and AED. Do you know what the top 3 causes of death in Taiwan are? Heart disease is the second. Every year, about 20,000 people in Taiwan experience cardiac arrest in the community, and they call the fire department for an ambulance. Before the ambulance arrives, actually, the most effective method is CPR plus AED. Research shows that just starting CPR can immediately double the patient's survival rate. If we assume AED is used, then the survival rate can be increased again. Since CPR is so important, who will be the first to perform CPR? Most of the time, it's people nearby. That means you, the students, you. Because CPR can prolong the survival time of vital organs. Time determines survival and quality. The faster you perform CPR on a patient, the more help it provides. Of course, purely relying on CPR to extend time is helpful. But if it can be combined with AED use, then the effect will be even better. Next, let's understand how CPR helps which organs. CPR significantly aids the heart, lungs, and brain. Moreover, the sooner CPR is implemented, when the heart stops, cells in the brain will start dying from the 4th minute. By the 10th minute, brain cells will be completely dead. At that point, survival chances are minimal. Even if revived, they often suffer from severe disabilities. The better it is. However, when we perform CPR, it's to delay cell death. So you can wait for AED use for emergency aid. Please explain, instructor, why does chest compression replace heart function? We just use external force to assist the patient to maintain a partial blood circulation flow since the heart has stopped. Imagine the human chest is like a balloon, enveloping a smaller balloon inside. That is the heart using compressions. Pressing the chest can indirectly compress the heart. Thus, it can increase the heart's output when the personnel arrive. Then, fellow students, you understand the importance of CPR. So, do you know how to perform CPR? How important is it to be willing to do CPR? This is a formula that can save a patient's life. Your role is more frontline than medical personnel. Please look at this chart. You can handle it. Call for help early, perform CPR early. When the collapses due to cardiac arrest, your actions are crucial to saving their life. And the 3 items to shock early. Most patients who survive and are discharged have most often had bystanders. Take immediate action with CPR. Speaking of this, isn't it exciting? Want to know what CPR is all about? The key phrase is simple, just 4 words. Call, compress, AED. Now let's take a break. The mantra is simple, just 4 words. Call out, apply pressure. Now let's take a break. How to use AED. Everyone can take a moment to think. And in this electric life, which aspects can you master? We'll come back for the next class. This student, please speak to the instructor. I remember we used to do mouth to mouth. Why isn't that used anymore? Importance of CPR plus AED. This student is good. A long time ago, the reason for not doing mouth to mouth is because research has found when a patient has a cardiac arrest, when they fall, the heart stops early. Chest compressions compared to breaths are more critical. And also the chest is like a balloon. When you press down, it expels air. Moreover, many people now hesitate to do chest compressions because they worry about mouth-to-mouth breathing, thus missing the opportunity to save a life. No, I was just asking you to call the duck shop. It's terrible. Let me order you a coffee first. This one is quite good. Give it a try. This coffee isn't bad. Oh, okay, let's continue talking. At the end of the last class, we talked about calling for power. So this class, let's learn together how to do it. First, make sure it's safe for you before approaching the patient. Otherwise, you might hurt more people. After ensuring safety, approach the patient for the first step by loudly shouting and tapping their shoulder to check for responsiveness. After confirming the patient is unresponsive, We must first call for assistance, which is the second step, calling for help. The second step has 3 important actions. First, I call 119 for fire department help, saying an ambulance is needed. I learned CPR before. Second, if someone is nearby, please include these. Third, observe if the patient has normal breathing. However, first, we need to understand what is normal breathing. Right now, everyone is normally breathing. So what is considered abnormal breathing? Well, that video just now. Displays abnormal breathing. It's somewhat like a whale, out of water behavior, a death struggle. They need to go for an AD. When you see such breathing, you should realize, I need to get ready to start CPR. And here's something else. We need to react. Instructor, I have a question. Why don't we check the pulse? Sir, please call 1999 for me. Sir, please dial A1 for me. The reason is quite simple. Even. So, when you usually don't practice checking pulse, our professional EMTs or healthcare personnel might face several issues. One could be that 2, there could. Therefore, statistically, B is greater than example, so you just need to. But what if there's only one person on site? Don't worry, at this time you don't need to get an AED. You just dial 11919 and someone will guide you on what to do. Just follow their instructions. Oh, okay. Make sure to check for responsiveness. What to press, what to press. Let me tell you. Students, we are ready to learn the third step. The duck is basically the chest. The pressing has a mnemonic. Press hard. Apply forcefully. Do not pause. First, understand where to press. The position is the line between the sternum and the nipple. The junction point, press hard to determine depth. 5 to 6 centimeters, quick press. It's all about speed, 100 to 120 compressions per minute. Rebound means ensuring each compression returns to its original position. Look at this cross-section of a pig's chest. When you start compressing from the highest point of the chest, make sure each push can spring back to that position. And during the second segment, try to keep compressing without interruption. Look at the chart. As long as when chest compressions stop, blood flow from the heart immediately decreases, and it needs to continue for a while to reach the peak. So keep compressing if possible. Just keep going. Next, let's see how standard chest compressions are done. Full breath. If not breathing, start CPR. Instructor, how can I tell if my compressions are good or bad? First, the position must be correct. No deviations. Second, depth. You must apply force. Because studies show that most people compress to a depth of 4 to 5 centimeters, commonly insufficient depth. Third, regarding speed, roughly 2 compressions per second. Fourth, regarding rebound, try to demand it of yourself. The chest should rebound without applying pressure on the patient. Finally, towards the end, if someone nearby is tired, switch off with them. If no one is available, push as best as you can until help arrives. Wait, what if I push too deep? The ribs might hurt or break. A broken rib will heal over time. But if the person is gone, there's no second chance. Oh, then just keep pressing. No way! Didn't I say no compressions on living people? Forget it. So what you said about the shock, is that real? Of course, it's real, isn't it, like in the shows? Where they get shocked back to life? No, let me tell you. Finally, we'll get into the so-called shock CPR and breathing, which will determine if CPR is needed. Alright, okay, shock refers to the electrodes, which means using an AED. In the first about the different types of AEDs. So what is the principle of an AED? It becomes chaotic. But this type of trembling is ineffective. The heart cannot contract effectively. To pump blood out, a normal heart rate is like in graph 1, and sometimes the heart goes into fibrillation. At this moment, CPR intervenes to allow the heart to maintain some perfusion, giving heart cells enough energy. After using the AED, the heart rate may change to a flat line as shown in graph 3. At this time, the heart's rhythm will reset, just like with a smartphone. Sometimes a phone acts up or runs slowly. We usually restart it to see if it works. At this point, with CPR, there's a chance the heart rate will return to normal. Just like that. The heart will also reset, with the AED playing the role of rebooting it. We know that there are many types of AEDs. So we'll using the diverse. Before watching the demonstration video, I want to give everyone a concept. There's no need to worry. The steps for using an AED are the same, and very simple, when continuously. Connect the pads. Apply the electrode pads to the patient's bare chest. Do not touch the patient. Do not touch the patient. Switch positions. Okay, it's advisable for the shop owner to leave. During CPR, good, I suggest the owner leave. In the state of CPR, the earlier you use the AED, the greater the help for the patient. Good, charge. Continue CPR. Start CPR, that's the way to use the AED. Any questions? Instructor, please. First point, observe the actions in the video. When electricity is introduced, will I also get electrocuted? Can pregnant women and children use the AED? Secondly, yes, pregnant women and children can also use it. Pregnant women should use it just like normal people, but for children, age must be taken into account. And the placement method. Age should be older than 1 month. Also, when the child's body is smaller, the patches should be placed on the front chest and back. Only then can effective shock be delivered. When the AED analyzes, everyone must step away from the patient. So there's no risk of electric shock. The most important point here, if there's excessive body hair, remove it before use. There will be patches on the chest along with other medications. After that, let's briefly mention. Using the AED can have some special situations. After removal, use the AED patches again. Some patients might. Or the ground is wet. Water accumulation. If they have a pacemaker, when applying AED patches, maintain a distance of at least 4 fingers and wipe them clean. Only then can you use the AED. Currently, the PPT portion ends here, and soon, we will prepare for group activities. First of all, coaches must communicate one thing to everyone, nor doctors. So our content consists of some videos sourced from the internet, our official versions. Provided material is just in textual narrative. Therefore, we have gathered several clips for everyone to watch. Our academy may also have nursing staff, and it's possible, thus we cannot discuss casually in class. Will we encounter situations like those in the video in our daily lives? Of course, it is possible. One day, the younger brother of a classmate suddenly went into cardiac arrest. Practical operation, everyone. Hello, everyone. Today we got on the ambulance and were taken to the hospital just to save a small life. So we should all be familiar with and have trained cardiac arrest and the crucial golden time, which is 10 minutes. Educators have previously attended classes on Redstone Wisdom, which is quite a valuable experience. Determining the quality of the response involves discussing first aid knowledge because there are children at home, involving bystanders, family, and friends. This signifies what? So start performing CPR. This discusses the golden time, since it could be needed at any moment, not knowing when it will be needed. Heart disease is the second leading cause of death. This concerns the first thing. We must first determine if the person is conscious. Next, the second thing. We must check if they are breathing. Breathing can be normal or abnormal. Following is the pulse. The video tells us not to check the pulse because it might delay the response. I once asked a retired nurse. She said, Checking the pulse isn't too difficult. On our neck, there's a groove. You can feel the artery there. Because it's actually pretty easy to reach. So this diagram shows us that we need to perform CPR, which means that each of us must learn the CPR technique. The heartbeat can be reset as a result of performing AED actions. It means each and every one of us must learn the CPR technique. The heart's beating will be reset. It's related to administering AED. Normal heart rate and heart tremors. It's beating, but this kind of fight is ineffective. Let's take a look at the report. Sinpuxian, Sinchu County. A 51-year-old man, after playing table tennis, he was preparing to rest, suddenly collapsed. A doctor playing table tennis nearby noticed. At that moment, confirming the patient, after finishing ad. CPR actions must continue. There are 2 here. They then carried out advanced life-saving techniques. After 4 shocks, the patient was pulled back from the brink of death. We discovered 3 things here. First, he was very lucky. There just happened to be a doctor nearby. Second, he had just finished playing table tennis. This means the myocardial infarction is unrelated to exercise. Both exercising and not exercising can result in myocardial infarction after 4 shocks. So the shocks weren't just once. The patient had no vital signs. Immediately performed CPR. First aid shortly after. Received assignment instructions for AED by trainee firefighters. After treatment at the hospital, he regained consciousness. Next, we delve into our main topic of first aid attempts. Our course will cover the introduction of first aid attempts. Understanding trauma. Common first aid methods and principles for fracture management. After wearing warm clothing once, it must continue. CPR, perform a segment of CPR, called artificial respiration. Automated external defibrillator. Then administer a shock. Total. Also discussed heat stroke. And heat exhaustion, burns. Lastly, we have a small questionnaire. Let's take a look at the content. This discusses that we are small vehicle drivers. Beyond understanding driving techniques, structure and other knowledge, one should also know how to handle unexpected accidents, such as car accidents, including bleeding control, fractures, CPR. 4 shocks were given, but only restored once, and CPR, and handling of heat stroke and heat exhaustion, hoping to reduce the injuries from accidents. In fact, I believe that this is knowledge everyone should learn. Introduction to first aid attempts. The definition and purpose of first aid. The definition of first aid is when a person suffers from an accident, injury, or sudden illness, in the absence of medical facilities, before being sent to the hospital, before medical personnel arrive, immediate emergency measures are given to the injured.
The purpose of first aid is to maintain or save lives.
Prevent worsening of injuries. 2 active sequences and principles. Safety. Confirm the injured. Ensure no further danger to the injured or rescuer. Assessment of the injured includes consciousness, breathing. For consciousness, can they respond normally to sound? Reaction to pain stimuli. For breathing, is it normal breathing? Normal breathing is 12 to 20 times per minute. Abnormal breathing would be less than 10 or more than 29 times per minute. For wounds, observe if there is bleeding. The second part is to seek help. Assist in reporting. Call 199 on the phone or mobile. If the mobile reception is poor, call 112 explaining the location. Conditions.
Details of support needed.
Wait for medical personnel to respond. At the end of the call, hang up. The principle of self-rescue is to heal the injured. The correct and comfortable position.
Prevent the condition from worsening.
Keep warm. Provide psychological support to the injured. Keep detailed records and continuously observe the condition of the injured. Understanding trauma. Definition, causes, and classifications of trauma. The definition refers to damage caused to external or internal tissues, resulting from external forces, including injuries caused by falling, blunt force trauma, car accidents, machinery and gunshots, etc. Closed and open parts of a fracture. Closed means the skin is intact. There are no open wounds. Tissues beneath the skin are damaged, such as bruises. Open means there are wounds on the skin, tissues underneath are also damaged, such as puncture wounds and lacerations, abrasions. Handling fibrous trauma. First, wear gloves and clean with water. Thoroughly wash your hands. Wear protective gloves or items. Clean the wound with cold running water. Physiological saline. Rinse around the wound. Rinse thoroughly. Use sterile cotton swabs or gauze to dry the wound. Protect the wound with disinfected gauze, or cover with a clean cloth. Management of severe trauma. First, stop the bleeding, then promote clotting. Do not remove it. Do not push broken bones or intestines into the wound. Next, give a sip of drink or withhold food. Observe and record vital signs. Seek resources and medical attention as soon as possible. When rescuers touch the bodily fluids of the injured, they should wear protective gloves first. To prevent infection, use hemostatic method. Next, let's look at common methods of hemostasis. Hey, what's wrong, Xiaobai? I'm so cold. Just hang in there. I'll be right with you. The ambulance is on its way. What should I do? Just hold on a little longer. Xiaobai, long time no see. Why do you look so heavy? Just looking at Dali's photo made me think if I had come to find you earlier, it would have been great to learn first aid skills. That way, when he got hurt, I wouldn't be so helpless. Don't blame yourself too much. I arrived late for class. I don't want to feel this helpless again. I want to learn first aid, especially emergency bleeding techniques. That way, maybe we can prevent more tragedies. That's right, learning these skills can effectively help patients with severe bleeding. Before this vehicle arrives, you could be a lifesaver. Ladies and gentlemen, when faced with an injury and bleeding incident, do you think, what can I do to help the injured? According to statistics, 35% of trauma deaths are due to severe bleeding. The function of blood in the human body is to transport oxygen to various organs, to maintain normal functioning. An adult has about 5 liters of blood. In the case of arterial bleeding, the amount of blood lost can exceed half a bottle of soda each minute. Without timely first aid, you could die within 5 minutes. In Taiwan, it takes an ambulance an average of 4 to 8 minutes to arrive at the scene. Therefore, when faced with patients with severe bleeding, relying solely on 119 is not enough. If someone nearby can carry out emergency bleeding control promptly, then there's a chance to save lives from bleeding. Today, we will demonstrate techniques based on the US emergency bleeding course. That is, developed through discussions among domestic experts. Emergency bleeding techniques, aimed at enabling more people to effectively assist those with severe bleeding before the ambulance arrives, to save lives in a timely manner. Shobai, let me ask you, when you arrive at the scene, what is the first thing you should do? Should be to immediately help stop the bleeding, right? Not correct. The first thing you need to do is ensure your own safety. Only in a safe situation. Can you help others? That's right. Your personal safety is the top priority. Your personal safety is the top priority. If you are injured too, you won't be able to help anyone and may even become another casualty. So please be cautious of potential dangers on site. For example, at the scene of a car accident, there might be a lot of shattered glass or fuel leaks. In the case of an earthquake, at the site of a collapsed building, there could be falling tiles or gas leaks from pipelines. As long as the scene becomes unsafe for any reason, you must leave quickly. If you have extra time and energy, then consider moving the injured, assisting in the treatment of the injured. May involve contact. If you have a wound on your hand, be sure to wear gloves before making contact. If you have no wounds yourself, and the injured person is bleeding heavily, you may consider treating them as soon as possible. Next, let's discuss the second method of first aid for bleeding. The information you report is crucial. Be sure to clearly communicate the following points. First, who you are and where you are. Are there any obvious landmarks nearby? And what has happened? For example, is it a car accident or another incident? Second, the number of injured, as well as the nature of their injuries. Third, are there any other safety threats, like a fire or unstable structures? With this information, the dispatcher can quickly assess and provide timely support. Once we have completed the call to one, we can start helping the patients. At this point, we should use the third method for assessing bleeding. Check for signs of severe bleeding. Use the mnemonic to check for a spray of blood. Is the blood spraying out? Is there continuous bleeding? Victim's clothes are soaked with blood. Or there's a large pool of blood on the ground. Breaks and merges, breaks and branches. Through these observable situations, we can determine if the patient is experiencing severe bleeding. After assessing the bleeding situation, we must also identify the location of the bleeding. The bleeding location can be categorized into limbs and trunk. As well as junctions, which include the neck. Why is it important to clearly categorize the location of bleeding? Because different bleeding sites require different strategies for controlling blood flow. This way, we know the best approach to stop the bleeding. The principle of hemostasis is to slow down blood flow. Allowing blood clotting factors to gather, forming a clot. and thus stopping the bleeding. Applying pressure to stop bleeding is the most direct and effective method. Sufficient to control most bleeding. Direct pressure means applying it directly above the bleeding site.
Exerting vertical pressure.
After applying pressure, the blood vessels will get compressed,
Hindering blood flow.
allowing the clotting factors in the blood to converge, forming a clot to stop the bleeding. Note, apply pressure vertically. This is necessary for effective hemostasis. When dealing with limbs, many people opt for gripping methods, which can actually reduce the effectiveness of direct pressure. When applying pressure, it should be sufficient to cover the wound with gauze. Excessive gauze can instead disperse the pressure, affecting the effectiveness of the pressure. The pressure applied must be strong enough to stop the bleeding. If it's the severe bleeding mentioned earlier, it will require a lot of force. You can have the patient lie down and apply strong vertical pressure, somewhat similar to the feeling of performing CPR, during the process. If the gauze gets soaked, it indicates that the applied pressure might not be sufficient. More force might be needed. At this point, you can place new gauze or dressing over it and apply pressure again. Applying vertical pressure once more. How long should pressure be applied? It should last at least 10 minutes. During this time, avoid constantly lifting it up to peak. If you're unsure how long to apply pressure, you can continue until 119 firefighters arrive to take over. If there is no gauze, what should we do? If you don't have suitable gauze like this on hand, we can use clean clothing.
Substituting for gauze for emergency treatment.
That should work. Remember not to use toilet paper. It's easy to tear and stick to the wound. If the wound is larger and deeper, merely applying pressure on the surface may not effectively compress the bleeding point. In such cases, consider inserting clean gauze into the wound. Then proceed to apply pressure. When pressure doesn't stop the bleeding, or if you're unable to perform this technique, you should use a tourniquet. A tourniquet should only be used for limb bleeding. Bleeding in the torso and junctions cannot utilize this method. When there is a spurting or severe bleed from a limb, using a tourniquet is a valid option. Tourniquets can be applied to oneself or others. They provide quick and effective hemostasis. When we use a tourniquet, there are several operational precautions. First, the tourniquet can be secured over thin clothing. However, if the clothing is thicker, it must be removed first. Second, avoid fastening it over bony prominences or joints. Third, remember to secure the lower limbs high and tight. If there are items such as wallets, keys, or coins in pockets, they must be removed first, or it will affect the tourniquet's effectiveness. Next, let's demonstrate the operation of the tourniquet. We are using the 7th generation CAT tourniquet. I will now demonstrate the application of the direct diagonal band. The direct diagonal band is placed 58 centimeters above the wound. We will pass the strap through the buckle. After tightening, secure it well. Next, twist the winding rod until the bleeding stops. Then, press the excess strap over the winding rod. Finally, attach the time strip to the securing slot and write the time of application. It's particularly important to note that the tourniquet works through twisting. The winding rod compresses blood vessels to achieve hemostatic effect. Thus, the patient will experience significant pain. Sometimes, a second tourniquet may even be needed to effectively control the bleeding. Therefore, remember not to remove the tourniquet until help arrives. After watching the above demonstration and explanation, do you now have a basic understanding of how to use a tourniquet? Please pay attention to 2 key points. First, the tourniquet must be applied at the central part of the neck, 5 to 8 cm above the wound. Second, the tourniquet must be tied to the bleeding stops. Otherwise, it will not only be ineffective, but may also worsen the situation. There are many different brands of tourniquets. Currently, there are medical device permits from the Ministry of Health and Welfare. The more commonly seen commercial tourniquets include the following 3 types. CAT, tourniquet, and sans tourniquet. So what if we don't have dual-use paper shoes? What should we do? If the situation is critical, and we have suitable materials available, we can make a homemade tourniquet. What materials do we need? We need fabric strips and a long stick. The fabric strip should be 56 centimeters wide. The length must be enough to bind the limb we need. The length must also be sufficiently sturdy to achieve twisting and direct diagonal effects. At least 15 to 20 centimeters long. When we don't have a proper tourniquet available, while we can use nearby items to create a simple tourniquet, this method is not very effective and has limited results. Unless there are suitable materials and extra manpower available, and you know how to operate properly, then you might consider doing this. In such cases, it's best to prioritize direct pressure for hemostasis, along with the soft tourniquet. The fate of trauma patients depends on the first pair of hands that apply pressure. Let's repeat today's key learning points. When faced with a patient experiencing acute bleeding, the mantra is safety. Call for help, identify and apply hemostasis. There are two methods of hemostasis: direct pressure and the use of a tourniquet. Direct pressure can be used for bleeding from any part. Remember to apply pressure vertically. And make sure the force is adequate. I hope everyone can learn and master these emergency hemostatic techniques after watching this video. Let's all become heroes who save lives. Next, let's look at the principles of fracture management. NA. Hello everyone, I am Huang Shiwei, the director of Shouchuan Hospital. Today, I would like to share a profound ancient knowledge. A fracture is when the bone is broken. Or it may develop a crack. At this moment, the bone cannot support the body's function. And around the bone, there are muscles, nerves, and blood vessels. So when a fracture occurs, it's not just the bone that gets injured. Nearby tissues may also be harmed. If you continue to move, the injured area could sustain further damage. Usually, when a bone is fractured, deformations in the limb are often visible. It might tilt or twist, presenting an abnormal shape. At this point, you can use a cushion or a coat. These soft items can support the injured area to prevent further movement. If the injury site has a watch, ring, or shoes, these items should be removed first. To avoid subsequent swelling that makes removal impossible, it's especially important to note: if the patient has both a fracture and severe bleeding, controlling the bleeding should take priority. Because bleeding can threaten life. Once the bleeding is stabilized, then you can attend to the fracture care. Finally, promptly ask for assistance from paramedics. Let's all come together for emergency response. 6. Cardiopulmonary resuscitation. We have already seen a video on this earlier. Dr. Singh once said, "We won't repeat that here." Next, let's watch a video on heat stroke and heat exhaustion. Hello everyone, I am Dr. Ye Ru from the Family Medicine Department of Shuangho Hospital. In light of the recent soaring temperatures, many people are suffering from heat injuries. Therefore, we are introducing heat exhaustion and heat stroke. Firstly, our heat injuries are categorized into 3 levels. Low-level mild symptoms include heat cramps, soft heat fainting. Moderate symptoms include heat exhaustion. Severe symptoms refer to heat stroke. Many people confuse these conditions. They mistakenly believe that heat exhaustion is the more severe issue. However, in reality, it's quite the opposite. When heat injuries originally occur, there is a massive loss of sweat, leading to an imbalance of ions, which may cause muscle cramps. This is known as heat cramps. The peripheral blood vessels dilate, resulting in reduced blood flow to the brain. This can lead to loss of consciousness, usually recovering within seconds. This is our heat fainting. If not managed, it progresses to the next step, which is the heat exhaustion phase. We continue to lose fluids and salts. This leads to fatigue, exhaustion, and lethargy. Some people may even feel headaches, nausea. But importantly, there won't be any altered consciousness. The body can still maintain its temperature. Sweating continues. Some additional symptoms might include pale skin, a relatively rapid pulse, but there may be a sense of weakness. Blood pressure may drop. If not further managed, it leads to heat stroke. This will exhibit certain characteristics: altered consciousness, and a body temperature exceeding 40 degrees Celsius. Skin that should be moist becomes dry and parched instead. If it continues unaddressed, it could ultimately result in death. This diagram is to help you remember heat exhaustion. The person will still be sweating, and their temperature might feel slightly moist. They appear pale. Their consciousness remains clear. If it progresses to heat stroke, there will be no sweating, and a body temperature exceeding 40 degrees Celsius. How serious is our heat injury? In fact, when we continuously lose fluids and salts, eventually urine production stops, leading to kidney damage. Toxins cannot be expelled. Body temperature continues to rise. Ultimately, this may result in damage to the heart, liver, and central nervous system, ultimately leading to damage to our heart. Liver and central nervous system harms as well. If not addressed soon, it could lead to death. In fact, our bodies normally make some adjustments. We can see from the chart in the bottom right that when normal body temperature encounters rising heat, the sweat glands actually expand through blood vessels to achieve temperature regulation in our bodies. However, when our temperature is too high, or the environment is too hot and humid, and heat dissipation is hindered, our body temperature will start to rise gradually. If not addressed continuously, it can lead to heat-related injuries. Generally, people misunderstand, thinking that danger only comes in high temperatures. But in fact, we also need to monitor humidity. A common example is that even if the temperature is only 30 degrees, if humidity rises to 60, we can enter a state of extreme caution. Even if it rains and humidity goes above 90, it may already be a dangerous situation. Recently, temperatures in Taiwan have been around 34 to 36 degrees, which already puts us in a state of extreme alert. If temperature and humidity continue to rise, we can see the relative humidity exceeds 50%, which has reached a dangerous situation. Therefore, everyone must remember to pay attention not only to temperature, but also to humidity. If heat exhaustion does occur and affects the central nervous system, the first step is to move the patient to a shaded, cool place, loosen clothing for ventilation, and lower body temperature. If there is cold or lukewarm water, the patient can be soaked, but remember to avoid using alcohol. Alcohol dissipates heat too quickly, which can actually cause our blood vessels to constrict, leading to poor heat dissipation. Additionally, some people may have allergic reactions to alcohol, which could cause skin damage. Next, if the patient is conscious, remember to give them fluids and electrolyte supplements. If there is a loss of consciousness, or if you notice a temperature exceeding 40 degrees and skin dryness, remember to call 119 hospital assistance. Importantly, take preventive measures. How can we prevent this? Usually we remind children, the elderly, and those with chronic illnesses to be especially cautious. Those who take medications for mental disorders should also pay special attention, as it can cause heat-related injuries. How to avoid this? Best method is to provide fluids and salts every 20 minutes. As for the temperature of the water, hot, lukewarm, cold, or ice water, which can be unsuitable for some digestive systems. Therefore, we recommend providing some cold water. What temperature should it be? We suggest about 10 to 15 degrees for cooler fluids. Additionally, if in a hot and humid environment, it's essential to take proper breaks, especially if any uncomfortable symptoms occur. Regarding clothing, we recommend wearing loose, breathable clothing in brighter colors rather than darker colors. In terms of lifestyle, remember to eat breakfast and ensure adequate sleep. Additionally, avoid smoking, drinking, and consuming caffeinated beverages to reduce the chances of heat-related injuries while enhancing the body's adaptability. Furthermore, it's crucial to remind you that if your body starts to feel unwell, do not push yourself. Remember to seek assistance from coworkers. Finally, a reminder that in environments or situations where heat-related injuries might occur, including for athletes, or while working in direct sunlight, in factories or high-temperature places, remember to wear light-colored, loose-fitting clothing. Additionally, ensure timely supplementation of fluids and salts. Of course, as I your condition, also monitor your colleagues' situations closely. Also, pay attention to your colleagues' conditions. If you're feeling unwell, remember to rest whenever needed. As for our family, 1. Patients often ask whether they can get gua sha or acupressure treatment. Usually, I suggest it's best after the acute phase has passed. And when there are some residual symptoms, or if the symptoms are not very severe, just heat cramps or feeling dizzy from the heat, scraping and acupressure are great complementary treatments. As for gua sha, when is it appropriate? Generally, I don't recommend scraping too hard until there are full bruises, because doing so will actually break capillaries. In fact, as long as the right acupoints are scraped and some sand comes out, that's a good way to perform gua sha. Regarding acupressure, traditional Chinese medicine recommends several points. You can try pressing these when you get home. The first one is the philtrum point. It's very easy to find just above our lips. As for the bai hui point, it's located at the intersection between our ears and the connecting line at the top center of the head. It's our bai hui point. Tan zong shu. This is our danzhong point. As for the da chui point, everyone can touch the back of their neck and feel for the most protruding position. That is our da chui point. Additionally, the hand points like the gu point and neguan point are also good acupressure locations. I hope everyone can properly prevent heat injury. Avoid causing themselves some discomfort and also remind friends around you. Thank you all for listening. Next, let's look at burns and scalds. Hello everyone, I'm local counsellor Huang Xufang. Today, I'd like to share a first aid knowledge. When the skin is harmed by a heat source or flames, it's called a burn or scald. After a burn, heat energy remains on the skin surface and continues to damage surrounding tissues. At this point, the most important action is to immediately lower the skin temperature. When burned, the first step is to immediately rinse the injured area with room temperature or cool water. Because the skin affected by burns is very fragile, water should flow gently over it. Don't use a strong water flow. While rinsing, you can carefully remove clothing or accessories from the injured area. But if the clothing has already stuck to the wound, don't forcibly remove it. Wait for hospital staff to handle it. If the burn area exceeds one body part, for example, an entire arm, the front chest, abdomen, upper back, lower back, or an entire thigh, or involves the face or genital area, after you start rinsing, immediately call 119 for help. If it's a small area burn, continue rinsing for at least 10 minutes, and then go to the hospital for treatment. Let's come together for first aid. Finally, let's move on to our questions. After watching the above informational video, which of the following items is not included? 1. CPR. 2. Common choking methods. 3. Principles for treating fractures. 4. Use of automated external defibrillator. 5. Heimlich maneuver. 6. Heat exhaustion and heat stroke. Finally, our course concludes. Thank you all for watching. Thank you all for watching.